Hello, thank you for joining in. Thank you, thank you, thank you. Let me see if I can connect to TikTok while I wait for our guest speaker to join us. How are you all doing? It's kind of a difficult moment for Nigerians at this time with the loss of two Nollywood actors. It's really like a hard blow. Difficult to swallow. We pray that the departed souls rest in peace and God should have mercy on us in Nigeria and stop all this untimely death. Okay. Our speaker will be joining us soon. Good afternoon from wherever you're watching us from. My name is Helen Onikbede and I am a registered nurse here in United States of America, and I will be bringing a registered nurse, a certified registered nurse with a doctorate award that has bachelor's in nursing, and she is running iCare Foundation. I'll be bringing her to join us live today. We're going to be talking about awareness on health. Okay, so I see her request. So let me see if I can connect this. I see Miss Tiwala will be joining us now. I just accept her. Hi, Miss Tilly.
Hi, sweetheart. Thank you so much for having me here today.
Thank you for calling, sis.
I appreciate you.
You're welcome. It is an honor to have you here. How are you doing today, ma'am?
Blessed. I am so blessed. Thank God.
All
Thank God
right,
for
great.
everything.
I'm trying to increase the volume. I'm sorry about that. So, thank you, Miss Siwa Ladialuko. And before I joined the live now, my husband just showed me something on the phone about another Nollywood actor that just passed away, Mr. Ibu, making it two now.
Wow.
Within the space of 24 hours. It's a hard blow because some of these things, we don't know what the diagnoses are anyway. Some of these different diagnoses that we hear left and right in Nigeria, I believe are things that should be able to be maintained medically. And it's difficult. All right,
This is
sis.
so sad.
It is sad. Welcome, sis. Okay,
Thank
so
you. Let me just say thank you. Thank you for having me. Thank you for getting in touch with me. This is just
you
just this
welcome.
morning, and I'm just overwhelmed with your
Oh,
love. I appreciate you.
thank you, sis. Thank you. It is an honor to have someone certified like you and into humanity. So it is an honor to have you on live. And I believe that we will be learning a lot from you, as well as creating awareness to the people in Nigeria about your foundation as well.
Yes, ma'am.
So I would love for you to introduce you to our viewers.
All right, thank you again. Hello, everyone in the house. Hello, everyone here in America, back home in Nigeria, Europe, everywhere you're joining. I'm saying hello. Thank you for coming. Thank you for joining. Thank you. My name is Tiwalade Aluko. All right, I am from Oshu State. I am registered here in United States of America. I work with Houston Methodist Hospital. Um, and I live here in Houston. I've been a nurse for 14 years now. I have my bachelor's in nursing from Indiana University, Kokomo. That's in Indianapolis, Indiana, to be precise.
Thank you very much, sis. Thank you for giving us that introduction. So,
Thank you.
my question actually, it's not much. I want to ask you about what prompted you to starting the foundation and why Nigeria?
Apparently, I just want to say, glory be to God, first of first. Uh, all this is just from God. Almighty God, I've been having a dream. I've been, thinking about it. It just kept coming. That was about 7 years ago. It just, kept coming to me that I should, start something like this. It wasn't like a foundation when it started coming to me. It was just like, going to Africa in general to help, serve humanity in terms of medical. So, and then I was reluctant. Like, how do I do this? How do I start? Then again, I had a dream another day, and then the Habakkuk 2, verse 2 and 3, came up to me, and the Almighty God says, I don't know it word for words, but it says, write the vision down. It probably tarry, but surely it will surely come, and it's not going to lie. It's not going to delay. So that came to me, and I was like, "Whew." This is it. God is telling me that you just need to stand. And then 7 years ago, I went to a family friend's wedding in Austin, and a lady came up to us in our room. We're just having after wedding party. Just having chill in the room and just having some conversation with the family friends and her. So the lady, I'm not too close to her. She came up and she was like, you're going to start something. You're going to be helping people in Africa. I see Nigeria. I see other Ghana. She mentioned, I think, about 7 different African names. And I was like, looking at her. Fortunately, my aunt, we went to the wedding together, and she was like looking at me like, she ain't got to call close me last week. That was 7 years ago. And I looked at her, we both looked at ourselves and smiled.
Wow, was the person a pastor?
Like, no, she wasn't a pastor. She was, I don't know who she is, but I know her, but I don't know her personally,
Okay.
And my aunt was looking at me like, oh, girl. And we smiled. So that gave me a confirmation to start. I don't know how, but it gave me that confirmation and that boldness to start, even though I don't know how it was going to, end up. So I just started.
Great, that's good. That's like you've been thinking about it and you received the word like, okay, go and
Yes.
do it.
Yes.
And you just start. That is good. So, but how do you get financial? How do you go about the financial part of it? Because I know you have to buy your ticket to travel to Nigeria, you have to buy medical supplies, you have to stay like hotel or eat and other stuff and recruit some people. How do you go about finances?
Uh, I will say again, to the glory of God. Everything is to the glory of God. So when we started, the vision and everything came up in 2017. But we didn't actually have the first outreach until 2018, which was the first one, and that was in Elisha, Ocean State. That's where I'm from.
Okay.
So the first one, it was all my pockets, from my pockets.
Wow.
But like I said, to the glory of God, my school father, he lives in London. I called him. I think we are just talking, and then I told him about it, and he said, "Tiwa, I'll send medications to Nigeria for you." That was the first year, 2018.
Wow.
So he gave me a lot of medication that time, and I was like, "Wow, this is really a
Yeah.
confirmation that God wants me to do
God
this."
wants you to do it.
Yes.
Yes.
So he gave a lot of medication. We bought medications from here, from Costco, Costco, and sending home. And afterwards, the second year, I met a friend here. I mean, I've known her, but we don't talk. We don't. We just say hello, when we see each other somewhere outside, party or something. So hello, hello. She is a pharmacist.
Okay.
And she was like, she saw the first pictures of the first outreach, and she said, Tiwa, I'm going to be your pharmacist from now on.
Wow, she lives here.
She lives here in United States, in Texas,
Wow.
to be precise. So since 2019, she has been donating all our medications. It's
Wow.
a lot of medications. If you see my posts on Facebook, Instagram, on WhatsApp status, it's a lot of medication that, I mean, I can't even imagine. She
Wow.
trusting me with all that medication, and we cargo it to Nigeria, and we just do our work, you know.
That's awesome. That is
So
awesome.
we have doctors from Nigeria that I
Okay.
recruit, and we have to do honorariums. We have
Wow.
nurses, we have pharmacists, and I have volunteer friends that come with me, nurse practitioner, doctors
From
that
United States?
from United States.
Wow, that's
Yes.
awesome.
In June, I had about 7 nurses and nurse practitioners that flew to Nigeria with me to Elisha. And 2 years ago, I think I had about 3. It just depends what time of the year we're going, who
Going.
is available, and
Yes.
they just volunteer to come, and they do perfect, amazing job over there.
Wow, that's awesome. So God
Yes,
is
ma'am.
fully involved. That is really good.
Yes,
God is fully involved, and we thank God about that.
yeah.
So that means you have help there, some help there, then you kind of like do most of the
Yes,
job.
ma'am.
That's
Mhm.
awesome. So, have you ever had any kind of distraction, setbacks? Because there was a time I met a nurse practitioner in California of blessed memory. She passed away last year. She was sharing her experience with me about talking to some medical practitioners here in United States. Thereby, they planned on going to Nigeria to have free medical services, surgery, eye surgery, heart surgery, and they all planned and they got all the equipment they were going to use, put it in cargo, and took it to Nigeria. And when she got to Nigeria, she was looking for a place that they can use, like they can rent, like a center so that they can have their surgery there, have all the equipment there. But the setback they got was the person that was supposed to let them use their own center was not forthcoming. And when they went back there, the person had put labels on them and sold the equipment to all the private clinic. Do you have setbacks like that, or do people just approve and welcome you?
Woo, that is heartbreaking. The
I
story you
know
just
it
said.
is. It
I'm
is.
sorry about that, but it just touched me. I've never had any story like that.
Oh, good.
I cargo all the medication myself. There is
Okay.
a cargo guy here that I take everything to. If like I said, if you watch my post,
Yeah.
every little thing I post, and I let people know this is what we're doing. From the day I get the medication from Jackson Park Pharmacy to the day I repack it, I'll take it down, I repack it and take it to the cargo. I will post and let people know this is what we're doing. In terms of locations, I don't have problem. The very first one, like I said, in Elisha, we use my dad's compound, which
Wow.
we just, the logistic in terms of what's it called, canopy,
Canopy?
chairs, and all that. We do that. We rent buses for some volunteers, because I have volunteers all over, from Abuja, from Lagos,
Oh,
from
wow.
Abeokuta, from Ibadan. So we rent buses, and I have a doctor that volunteers every time. His name is Dr. Ajay Tumobi. He provides some things for us, like in terms of his hospital. He owns a hospital in Ogbomoso. I mean, sorry, Oshogbo, Osun State.
Oh,
So if
okay.
we have surgery like that, it will we will use the hospital for that.
Oh, that's
Yes,
awesome. That's really
yes.
good.
They will take them to his hospital. They will do the surgery over there in in his hospital in Oshogbo. So I never experienced any bad, you know. I think it's just God all the way. In
Yeah.
terms of the volunteers are very dedicated. Let me use this time to. I know some of my volunteers will be on live here. Let me
Okay.
just appreciate them. I want to say thank you. Thank you very much. Because I won't be able to do it on my
For
own.
by
I
yourself.
cannot. That's period. That is the fact.
Yeah.
So I'm using this time, this opportunity while my sister have put me live to the world. I'm using this time to say thank you. God bless you. I appreciate you every day. They are awesome. Sis, I
Yeah.
will not lie to you. I have the best volunteer in the whole wide world.
That is good.
So
Okay,
it
so
makes my
before
job easier. It makes
they
me
make it
volunteering
easy.
and doing the work easier.
Yes,
Yes,
that is
ma'am.
awesome. So before I ask you the next question, I'm going to be asking you medication question about the medication. I'm going to do a big shout out to our sponsor for today, which is Suya on the Spot. She is the sponsor of today's live chat. Miss Jumai, the CEO of Suya on the Spot on Highway 6. They will be having Ewa Agoyin tomorrow, Sunday, live at Suya on the Spot. So if you need Ewa Agoyin, you've been craving for Ewa Agoyin and you miss Nigeria Ewa Agoyin, please reach out to Suya on the Spot. We're gonna be posting more information about it. Thank you so much, Suya on the Spot, for giving us this time and sponsoring this live chat. Thank you. So my next question, Ms. Tiwalade, is the medication that you talk about, like that will be going to Nigeria. So when people try to reach out to you, are they like anti-hypertensive medication, diabetic medication? What kind of medication? What and how can people reach out to you if they want to partake in getting medical services through your foundation, iCare Foundation? How can they go about that?
Okay, thank you. We have different kinds of medication. A lot of medications, like for hypertension, for diabetic, vitamins. We have for pain, acute pain, chronic pain. If you want me to mention me names, I can do so. We
Okay.
have cream for pain as well. We have I already mentioned vitamins. We have other medications for other illness for ulcer. We do have those medications. We have cane. We have walker for the elderly. We have diapers
You
for the
have all
elderly.
that too?
Yes, ma'am. Yes,
Wow. So it's not just oral medication only. You also provide them supplies
yes,
that they can use.
yes, ma'am.
Oh wow, that is really good.
Yes,
That is really good. That's a big effort. Thank you for that.
yes,
Okay, now let's go to the medical part of it, especially the reason why I actually come up with the idea. I've been battling this idea of having like a health talk whereby I can bring medical practitioners to come online and speak with people,
mm,
especially because of Nigeria situation. Like we lost an Hollywood actor yesterday, we lost another one
mm,
today, Sissy Quadri, and the video went viral about him going to the hospital and complaining about, I believe, if I'm not mistaken, don't quote me, I believe he was asking about his lab work
mm.
and wanted to find out about what the results are. And I was thinking in myself, like, why should it be a big deal for him to get his lab work? Because it is his own, it's his right to know what his lab
Of,
work are, even
of
though he
course.
might not actually understand what the result is about. You might have a medical practitioner in the family, or probably trying to get a second
You're right.
opinion. Yeah, so what are the signs and symptoms that you can advise Nigerians to watch out for, that will prompt them to say, okay, it's time for me to go to the hospital and get checked? What are the little signs that you think, and changes you think it will be in the body for them to go see a doctor?
Okay, first of all, let me say this. Nothing to prompt you to say you want to go to the doctor.
Okay.
It's a compulsory thing that we have to check our labs. If you don't have any medical issues, you can do it yearly, annually. So not to talk about those ones that they know that they're diabetic or they're hypertensive. We all, in general, we need to check our health every time. Meaning that if you don't have any issues at all, check every year. You need to go to the doctor to do all your lab works. All the physical assessment, you need to do that annually. Then if you know, or if someone in the family, a relative, parents, siblings, have any medical issue, then you should try every 6 months, twice a year.
Yeah.
Let me use diabetic as an example. Okay, if you're diabetic and the doctor will ask for your A1C. A1C
Yes.
means that this is the lab that will show all your fasting blood sugar that you've been doing 3 months, and that will help in terms of giving you medications, because some medication can work for this patient and it will not work for the other patients.
Yes.
So if you're not doing all these tests, and if you're just doing your paracetamol at home, it's not going to work. So you need to make sure, if you have any health issue, check every 6 months or every 3 months. Depends on your physician, your doctor. But if you don't have any issues at all, I will advise annually, to go ahead and check your blood work.
Okay. And does it matter the age of
Yes,
the
age
person?
matters too.
Okay.
Okay, I'm going to use mammogram because you mentioned age.
Yes.
Let me use that for example. If you're over 40, for women, you need to go and check for your mammogram. Some doctors will say if you don't have anybody in your family that has cancer, or you don't have, you'll say every 2 years. Most of the time, it's every year you need to check your mammogram and do self-examination at home. So I'm using that as an example. So age matters in some, medical issues.
Diagnosis.
Yes, ma'am.
Yes. So, from the country that we come from, I will use the word ignorance,
That's right.
and I will also borrow the word fear. Like, we are scared of, we are like fear of the unknown. Like,
Yes,
I do not want to know if something is wrong with me, because
that's right.
they because they believe that the moment they find out that this is what is going on in their body,
Mm.
that they start experiencing the signs, and it means they're gonna die. And sometimes, you knowing on time if something is going on can help you, and they can start preventative and full treatment to eradicate whatever the situation might be. What do you have to say about that?
That is very, very, very important. Like what iCare, it's all about. We're doing this for everyone, to be able to have early detection. Like now, I'm going to use another medical issue, for example, hypertension.
Yes.
We you're in the medical field. We know, or maybe the medical personnel knows that some people don't even have the symptoms, you
Yes.
know, and especially in Nigeria, when they just have headache, you know, they will just take paracetamol. Some headache might be that your blood pressure is high. You need to go see the doctor. So I'm going to use that as an example, because if you go to your doctor and do early testing, check yourself, you will be able to, get cured, or you're able to prevent it. Like hypertension, if you get it early, that you know that you're hypertensive, they will tell you about your weight. If you're overweight, go ahead and lose weight. If you're eating too much salt, go ahead and cancel that salt. Reduce your salt intake.
Yes.
Do your exercise. Eat a lot of fruits. Your vegetable is very important at that time. So early for you to be able to get cured, or for you to be able to get make sure you maintain it. It's not a death sentence.
I know.
But a lot of people will not do that. They'll just say, headache, they will even call me, or headache me, let me take paracetamol and that's it. No. Go and check your blood pressure. If you know you have high blood pressure, go ahead and check it morning and night. If you can't check it, if you maybe once a week for some people, but at least we need to check and make
Yes.
sure that we're able to take our medication. Some people, they get off medications if you're able to do your exercise, you're able to lose weight, you're
And
able
good
to stop your
diet.
alcohol. Some people will be drinking alcohol. Stress can cause high blood pressure. You understand? So it's very important that we know early for us to be able to get cured. And if it's not curable, some disease or some medical illness, then you can manage it.
Yes.
You can
And buy
manage it.
yourself time.
Yes,
Yes.
ma'am.
Yeah. Thank you, my sister. I'm going to quickly pause on that
Thank
again.
you.
Thank you very much for joining us. I see a lot of people have been addressing you, Sister Miss Tiwalade, but I can't cut you off to acknowledge them. I'm so sorry I couldn't call names. Thank you for joining us. Please, I will be posting this later on Instagram here and all other social platforms. I will be posting it on YouTube as well. And I'm going to do a big shout out again for our sponsor today, which is Suya on the Spot. The CEO of Suya on the Spot is our sponsor for this live chat, educative chat, whereby I was able to bring Miss Tualade Aluko to you, whereby
Thanks
she's
for having me.
about iCare Foundation and how you can reach out to Miss Tiwalade. And I'm going to be posting it as well. I'll try and pin it to my reels and feed so that people can easily have access to it and be able to find you when you get to Osun
Thank
State. Okay,
you.
so now the other question I was about to ask you, you already answered it, which are the benefits of physical assessment. And so, what are the risks of self-diagnosing? Because I know that a lot of we nurses sometimes we are guilty as well. Like you see it sometimes and you go on Google and you start typing it like, okay, what is going on here? What are the risks of self-diagnosing and self-treatment?
I already mentioned
The
part of it earlier.
yes.
Like I said, if you do not go to the doctor and get, diagnosed, you're getting yourself being a failure. You understand?
Yeah.
So that you will be able to get treatment. You'll be able to know which medication works for you better. If you're taking paracetamol every day, and you do not know that you have high blood pressure, and you're supposed to be taking Novax and aminopidine, then you're getting yourself being a failure. You're getting yourself getting stroke. You're
At
getting
the
yourself getting I heart
heart
failure.
attack, heart failure,
Yes, ma'am. So
cardiac
that's why
arrest.
early, diagnosis, or going to your doctor to check yourself annually, 6 months, it's very important. So it's just like diabetic, as like I said earlier. It can cause different kind of comorbidity in terms of you're diabetic, you have high blood pressure, your kidney is already failing. So
Yes.
many things are shutting down. So it's not going to just be one thing. it's going to lead to different kind of health issue. You
Yes.
know, diabetic, if you're not checking your feet, you fall one time, that's it. You got a wound, it's going to get bigger. And
And it's
it's
not
going
gonna
to,
heal.
yeah, that's very difficult to take care of diabetic wounds. But if you know that you're diabetic, you know how to move around. You're not supposed to fall. You're supposed to wear your good shoes for you not to have wound. These things is very important. But if you're not just taking paracetamol at home, I'm sorry, it can be tough.
Can you also talk about the risk of them having kidney failure from taking paracetamol every day?
um, your liver is still going to shut down too. You're taking
Exactly.
paracetamol every time is not a good thing for your liver. Tylenol is not. So that's why I said some medications are not good for some patients, and some medications are good for some patients. Ibuprofen might not good for the ulcer people. Your doctor will tell you not to take ibuprofen. So it depends on your diagnosis, and you cannot compare, what you are going through, your health issue, with another person's health issue.
So,
You know.
exactly.
Yes,
Thank you for that. Okay, and there's another one that I noticed in Nigerians about laboratory and diagnostic screening. Like if a doctor see, some people will go and see a medical practitioner and complain about, okay, I have headache, I'm having stomach upset, I'm experiencing nausea, sometimes I throw up, I feel like my private area is itching, I'm burning, and some doctors will request that a patient go to the lab and give them some of their urine samples. Some will be requested to go for blood draw. Some of them will be requested to go for X-ray and CT scan. And a lot of people are saying, okay, when the doctor starts saying that we should go for X-ray and CT scan, it's costing them a lot of money. And sometimes the appointments are kind of backed up because they
that's
have a
right.
lot of people online trying to go for this diagnostic screening, and they don't think they need it, thereby they turn to uh, would that be orthodox treatment? Agbo. They
Abo.
now turn to Yalagbo at the bottom. Pardon me, I'm not saying Agbo is not good. The only problem I have with the Agbo is the fact that the
Yes.
measurements. Because if you are taking 2 cups of the herbs, you don't know if you are overdosing
Yes.
or you are underdosing it. That's the only issue
You're
that I
right.
have when it comes to that. And the another issue I have with it is the fact that if you have a pre-existing condition that you were not aware of, and you taking agbo, you don't know if what you're taking can affect you. That's the only issue I have with agbo. So now, sis, can you please tell them the benefits of going for lab work and diagnostic screening, what the doctors are watching out for?
Uh, the doctors are experts in terms of, they request for any test is for them to be able to treat you. It's for
Yes.
them to be able to know the next step. Okay, I'm going to use breast cancer as an example because we need to use some examples so that they can, be
Understand?
knowledgeable and know. So if you're doing self-exam and then you go to the doctor, they will also want you to do your mammogram. It's for them to be able to detect early, and also if you're a candidate to do surgery, if you
Yes.
understand. If you don't go ahead and do the mammogram, if you don't go ahead and do this MRI, if you don't go ahead and do this CT scan, how would they be able to know the next step? How would they be able to know if you're a candidate to get surgery, to get chemo, for you to be able to, get cured? There's a lot of breast cancer survivors. So
Yes.
it is very important when they tell you to do any test. I know, in terms of Nigeria, issues about financial, support, and that's why iCare comes in terms of being able to partner with hospitals, partners with individuals that can help us so that we can be able to do more for our patients, for our beneficiaries, you know, because like my friend, the pharmacist, so we have some private patients that we, after the mission, after the medical mission, we have them that will, they come to us, we are giving them medications every time, not just a one-time medication. So these are the kind of things that people need to be aware of, that please, if your doctor, request any types of tests, it is just not for their benefit. It is for your own benefit, so that they will be able to know the next step to take and which medication will be better for you, which, surgery is going to be better for you.
Thank you very much, Miss Tiwalade. We are actually getting to the end of the questions and answers, so
No
I'm going to
problem.
give another shout out to the sponsor of today's live educative event, which is Suya on the Spot. Suya on the Spot is on Highway 6 beside Walmart. Highway 6 South beside Walmart. Please try and go to Suya on the Spot. Give it a try. This is actual Nigeria, northern part of Nigeria suya. These are original suya, correct suya. They sell the pepper for the suya. Go there and tell them you are from Terrific Beauty Fashionista and you are getting a good discount. Thank you so much, Suya on the Spot. Thank you so much, Ms. Tiwalade Aluko.
Thank
It
you
is
for
so
having me, my
nice
sister.
to have you here. I am so excited because you are actually my number one nurse practitioner on the hair. Thank you so much.
Thank you,
I'm
ma'am.
so excited to have you
I
on
appreciate
the
you. I'm
building.
so glad to be here today. I'm so
Thank
excited.
you.
Thank you.
Thank you so much. So, my followers, fans, brothers, sisters, daddy, mommies, you have heard from Miss Tiwalade Aluko. I will be giving her a chance to tell you about information, phone numbers, addresses of where you can meet them up for you to be assessed. You heard about how other doctors and other nurses are in partners with us, so it's not just she's doing it by herself. You're going to be seeing medical practitioners that's going to be assessing you, diagnosing you, and give you a new treatment plan. And guess what? Now they said they have medication, they have supplies for you people that need a walking cane, you need a walker. Reach out to me, Siwalade Aluko. She's bringing them to Nigeria for you. And now, may the departed soul of Sisi Quadri and Mr. Ibu rest in peace. It is very, very painful because Nigeria being the giant of Africa, I believe Nigeria should be one of the countries that people can fly into to say we're going for treatment. That is because we are capable. I believe Nigeria is capable of having one of the best hospitals in the whole world. We have, I go to hospitals to work sometimes, I see Nigerian doctors, I see neurosurgeons, Nigerians, I
That's
see
right.
Nigerians at big hospitals in
right.
United States. They don't just go there and say, okay, I want to edge this hospital. It's because they are overqualified.
That's right.
They are qualified in their field. They know their onions. And for them to do marvelous things in the United States of America, if we can work on our own country, trust me, a lot of them, they love to do volunteering. They love volunteering. They can team up with Miss Tiwalade. A lot of people are teaming up with Miss Tiwalade now to help people in Nigeria. It's you contributing towards the good thing of Nigeria as well, because it's like our politicians and leaders are kind of like backed up and they really don't have much power or strength to do the things that they're supposed to do. And we have a lot of individuals now stepping up and saying, okay, I want to go and help my people in my country. So, Ms. Tiwalade, please give people information. I will also be posting this information on all social media platforms
Thank
that
you,
belongs
ma'am.
to Therapy Beauty Fashionista. Please give us information of how they can reach you here in United States and Nigeria and iCare Foundation.
Thank you so much, my sister. God bless you. Thank you for this
Wow.
opportunity. Thank you for this awesome, amazing time
Thank you
with
for coming.
everyone that has joined. And I say hello to everyone, all the followers, families, friends, all my volunteers. I know they're here. All your followers. Saying hello. So I Care for All Foundation, we have a Facebook page, we have a website. I'll give everything to you. We have our IG too. Phone number is there. For now, we do medical outreach twice a year. Uh,
Okay.
we don't have a specific month or date. The next one that is coming up is going to be in Ede, Osun State,
Okay.
uh, on the March 12th, 13th, and 14th of this year. So it's going to come up in Adventist Government High School, yes, Adventist Government High School in Ede, Osun State. And we have another one that is coming up in Ijebu-Ode. I don't have the address off my head,
Okay.
but it's in Ijebu-Ode. That's going to be March 21st. What do we do there? We'll check your blood pressure, the vital sign, blood pressure, blood sugar, fasting blood sugar. We're not doing A1C there, but we can refer you if we see that your fasting blood sugar is pretty high. We'll require you to, we have partner hospital that help us. Like I mentioned earlier, that
Okay.
Dr. Ajay his hospital is in uh,
Shobo.
Osogbo, and it helps with that. So you can check your A1C there. But at the site, at the venue, we check blood sugar, blood pressure, and then you will see the doctor that will do a thorough physical assessment. After doing the assessment, most of these are patients, my sis, they know what they're taking. They don't have money to buy those medications. They know they're taking Novas. They know they're taking metformin, but they
So
don't
they
have the
come
money
with
to
the
buy it.
list. They
So we
come with
have
the list.
metformin, Novas, pain medications, ulcer medication, atorvastatin. We have so many medication, vitamins. If you don't have any medical issues, maybe it's just pain, just come. We'll give you pain medication. If it's just vitamin C, vitamin D, calcium that you need, we have it. So
Wow.
after seeing the doctor, you will tell them that, okay, you need reading glasses. You have to make sure you tell the doctor before they can tell you to go to the optician, because the optician are on one side. The
Okay.
dental departments are on one side. You just don't go to them. Yeah.
Wow.
So it's the doctor that will write a note and say, okay, go ahead and see the dentist. The dentist, sometimes we see this patient that their tooth, they had, decay and, different kind of things. The dentist will do extraction.
You
Meaning,
do extraction too.
yeah, meaning that they will take off their
The
tooth.
tooth.
Yes,
Wow.
ma'am. So they will have a relief. They will come in pain. They will go back
And
home
live
in peace.
with pain free.
So the doctor has to write that note saying that you can see the dentist, and then the doctor also has to write a note that you can see the optician, where they will test you and see which glasses that you will need. If it's a prescription glasses, if it's a reading glasses for you to read your Bible, your Quran, they will get you a glasses at that time. So, but you have to make sure you see the
Doctor.
doctor. After all that, then the doctor will still write you your prescription, which you will take to the medication department. We have a sign says medication. Our pharmacist is there, nurses
Okay.
are there to help you, and they will educate you about the medication you're about to receive. If you're taking Tylenol, they will educate you about if you have any liver issue. What about ibuprofen? What about Novas? Sometimes you might have some side effects. So we have a little sheet that says all the side effects of all the medications that you're going to be taking. You cannot just stop your medication like that and say, because of the side effect. There's some other medication that will give you, that will help you with those side effects. Maybe you're nauseated, you can get some nausea medication, like that. So you cannot just stop your Novax and say it's causing you swelling or something. You might have to reduce the dosage of your medications. So things like that. So that's how the process goes. It's like here in the ER when you go to the ER. So it's like a mini clinic slash ER, what we do in our care.
You
So the
kind of like do a
medication part is the
triage.
last one that you will get and go home. Bye-bye.
So you kind of do triage. You
Yes,
do a
ma'am.
triage for just some few days and
Yes.
you leave.
Yes.
That is massive. Because at first, before we started talking, I was thinking it's just you just going there, doing vital sign, listening to heart, lungs, and that's it. So do you guys have like a situation whereby people come with signs and symptoms of UTI, and whereby you kind of like prescribe antibiotics?
We have antibiotics, we have anti-malaria, we have cough medication for the children.
Oh wow! So
Yes,
it's all rounded. It's all rounded.
yes,
Okay, so people can, if they don't have doctors in Lagos, they can actually come meet you guys in Ijebu Ode.
yes, yeah.
Yes.
You can come to Ijebode, you can come to Ede. You know,
Okay. So
the one we did in Elisha last year, we had people came from Akure, people came from Ijebu, people came from what's it called, Abeokuta.
okay, my last question, Miss Tualade, how do
Yes.
you create awareness for the people in Nigeria for them to know that you are coming at a certain time?
So starting from when this week, the radio station in Ede, Elisha, Oshogbo, they have the thing called jingles.
Jingle, yeah.
Yes, ma'am. So they have about 3 slots every day, and they will, it's right there, broadcast on the radio.
Broadcasting,
Yes,
and people
and
will
there's
come out.
few days before, they have flyers all over the markets, the streets of Ede, Elisha, Oshogbo, any surrounding areas. That's what we do. And 3 months before any mission, I'll post on my story, my IG, my Facebook, and my status, WhatsApp
So
status.
people will have a clue what is actually happening.
Yes, ma'am.
Okay,
But
thank you so much.
the week before, or like this week, they already have the flyers all over in Ede. I mean, banners.
Okay,
Yeah, banners in Ede.
that is already telling them that something like this is gonna happen and
Yes,
people can
ma'am.
come for treatment.
Yes, ma'am.
Okay. Oh, that's really awesome. So, another question, real quick. Do we have people that actually come there and after the whole event, they just stay back and say, we came from Boya, like we came from like Ilori, and we don't have transportation to go back? Do we have some people that come up like that? Do we have people that complain when they get there like àgbàtàbá fẹ́ lóògùn báyìí kò dẹ̀ sí oúnjẹ táwọn máa jẹ? Do we have people that complains like that?
Um, um, it's very difficult to answer that on on the air now, but I mean, I'll say a little. We've experienced that in the past. Okay, we have some sponsor like friends that will give me certain amount of money and say hold on to this. During the time, we might have people come travel from far and say, we came because of this and we don't have transportation. Yes, we have experienced that. We have had people like that before. We are able to give them, little token
To
to
go
go
back
back
home.
home. Yes, ma'am. It
Wow,
has happened
God,
before. It's
God
not.
will,
It's not
God
a new
will
thing.
bless you bountifully, Miss Tiwalade. You are
Amen.
doing a good job.
Amen.
I'm so proud
Thank
of you.
thank you
Thank you
so much,
so much,
ma'am.
ma'am. Big shout out to everyone that joined this program. Big shout out to Suya on the spot for giving us this platform by sponsoring us. Thank you so much. Please stop by at Suya on the spot for your Suya. They have the allow, and they will be having allow throughout Ramadan. They're already preparing for all my Muslim sisters and brothers. And she was even telling me that there will be more and more Elewe during Ramadan. And she has a lot of goodies that she's putting in place for the Ramadan period. Please stop by at Suya at the spot and tell them from Terrific Beauty Fashionista, you're going to be getting a discount. Miss Tiwalade Aluko,
Yes,
thank you
ma'am.
so much
Thank
for
you for
giving me
having
your
me.
time. I truly
I
appreciate my
appreciate you more.
my Nigerian brothers, sisters, daddy, mommy. Miss Tiwalade Aluko is our first medical practitioner coming onto our live chat. We will be bringing different medical practitioners to come talk to us. I am working on getting some people to come talk to us about mental health because a lot of people are suffering from mental issues. Mental health does not necessarily mean by you sitting by the roadside, you munching from the waist back. We have a lot of people going through depression. We have a lot of people having some signs and symptoms of bipolar, manic bipolar, depression. A lot of things going on. I'm gonna be bringing OBGYN nurse on this platform. I have them handy. I have spoken to some of my physician assistants at my hospital, which are non-Africans. I'm gonna be bringing Onibos that you will be able to ask questions. We're gonna be bringing nephrologists, rheumatologists, pulmonary doctors. We're gonna bring internal medicine, internal disease. We are going to be working on our health since Nigeria is a big place whereby medical issues are kind of being handled anyhow because I strongly believe, Mr. Walade,
Yes, ma'am.
you can tell me if I'm wrong or right. I strongly believe a lot of people will be buried and they will later on wake up in the grave
Mm.
with the way Nigeria is. I do not know why I have that feeling.
That feelings.
I strongly believe a lot of people just glide into coma,
That's right.
in which they might wake up later in the grave.
That's right.
Because there is nothing like CPR.
Mm-hmm.
We need to create CPR awareness in Nigeria,
Yes.
English, Maneuver, first aid treatment. Before I came to United States, in the bus stop, I saw a lady throwing up blood. And everybody just stood there and was like, hey,
And they're
yeah, oh
watching.
my show. There was nothing anybody
Mm-hmm.
could do. Even if they said they should call an ambulance, there is no way an ambulance will get there to come take that lady with the traffic that was there. I quickly took an emergency ambulance.
Whenever we do the let me put this in. Whenever we do the medical outreach, we have blood pressure of 120, 220, 205 over 100. Yes, ma'am. Mm-hmm.
Wow, that is
Yes,
a
ma'am.
stroke.
The systolic is 205, 180. Diastolic in the 100, 113. Yes, ma'am, we do. So you're not wrong. Mm-hmm. That's
Oh my
right.
God.
And they will come with their paper or their sachets of medication and say, "Oh, Otiton, we don't have money to buy another medication." Mm-hmm. They know what they're taking. Most of those people that come to the outreach, they do know what they're taking. They do have it.
Just the money
Lisinopril,
to buy.
yes, Metropolo. They do know it. They will bring it to the site, and they will say, it's finished, and their blood pressure will be reading in the 200, in the 190s.
Wow.
Yeah, we had blood sugar of 500 before. We had to call. I called my driver. They took her to the because I don't carry insulin. The only thing we don't have is we don't do insulin. But we gave
So
her
they have to go get
metformin
insulin at
for
the
daily
hospital.
use, and we told the driver to take her to the clinic around. That was the time we did Ekpe medical outreach. So our blood sugar was 500.
So, like in Nigeria, when you told them to take the person to the clinic, do they have like insulin therapy? Do they have times they have to do dialysis? Do they have stuff
I
like
didn't follow
that?
up with that patient. The only thing I follow up is just pay the bill, and they gave her insulin. It dropped, and she got what's it called? She got
Metformin.
metformin from us. But I didn't follow up later to see, what are the things that, because it was a 2 days medical mission in Ekpe 2021 that time. But
Wow.
we paid for our hospital, treatments.
Treatments.
Yes, ma'am.
Yeah. Thank you so much, Ms. Tiwalade. We have a
Thank
lot
you.
of people that are also willing here to pay medical treatments and other stuff, but they
Thank you.
don't even know how to go about it. So I'm going to be giving them your information to
Yes, ma'am.
reach out to you. Thank you so
We
much,
need
Ms.
donations
Tiwalade.
because our volunteers, even though they do volunteer, we still, say thank you for coming. Thank you for leaving your home, your family, your
Yes.
work to come volunteer. We try to take care of our volunteers.
Yes.
In terms of feeding them, hotels where we're going to stay in Ede, in terms of honorarium, appreciate them so that the
Yes.
next time we're able to call them and say we have another city that we're going, and they are willing to come.
To come.
So we try to be fair to everybody, even though they're taking care of beneficiaries. Sometimes in a day we have about over 1,000 beneficiaries that will show
Are
up.
you serious?
Yes, ma'am. Over. Hmm. There is a
Wow.
video that I just watched recently. It was saying we were about to leave the hotel to go to the site, and the video, one of us was saying we're trying to get into the. They say, actually, about 360 people where they can jump by a one bus.
Are
It
you
was
serious?
funny, but truly, by the time we got to the field, it was already because they get a card. We'll give them a card when they come in.
Okay.
We have registration department that they already went over there to the field and start getting their names, giving them access card for them to be able to. We have by the time it's noon, we already seen 800 people. So over 1,000 sometimes. Yes,
Wow.
ma'am.
And that's just like 2, 3 days in 6 months.
Yes,
So we have a lot of people that are actually stranded,
that's right.
that are not able to see medical doctors when they want to
Hmm.
because they don't have the money.
Yes, I have over 60 volunteers, and then families and friends. My siblings. I'm shouting out to my siblings, my sister, my brothers. They come out to support me. None of them is medical personnel, but they will come out to do just support in any way they can. Maybe coordinating. Getting all the volunteers water, drink, whatever they need to be able to be functioning and do their work. So they do support me. So shout out to them. I know my sister is watching. I think my brothers are here too.
Oh, that's awesome. Thank you very much for participating. Thank you to all the volunteers. Thank you for the initiative, Ms. Tiwalade.
Thank
It's
God.
so nice to
Thank
have
God.
you here. And so we will be rounding up today's event. We have spent 58 minutes so far. Thank you very much for coming. Thank you, Suya on the spot. Guys, please go to Suya on the spot and get your discount on the Suya. She is waiting for you. Miss Tiwalade, I will be talking to you
Thank,
soon. Thank you very much. You have a beautiful day.
thank you. I appreciate you for having me.
You're
God bless
welcome.
you, and
God
you
bless you.
stay blessed.
I will. Thank you, ma'am. And to all my followers, you have a beautiful day. I will be posting this for those people that miss it. Have a beautiful day, and it's the end of the day. Bye.